I'm Dr. Ryan Stanton for Tools of the Trade, and today I'm here at Baptist Health Lexington talking about a new procedure that's here to help stroke victims. I'm going to talk with the physician and a patient that benefited from the procedure. It's called mechanical intra-arterial thrombectomy, and it can save a life. It's hard to imagine it now, but just a few days ago, Sherry Wanchik was in the fight of her life when she developed the symptoms of a large stroke.
My right side was numb. It happened real quickly. I couldn't move my leg or my arm.
Her husband, Mark, recalls how that Friday evening played out.
She couldn't speak. She had no movement of her right hand or right leg, either one. Her right side was drooping. Her eyes were a little bit different. She had what you would call a thick tongue. She really couldn't articulate any words.
After she was diagnosed at Georgetown Community Hospital, she was transferred by ambulance to Baptist Health in Lexington, where Dr. Curtis Given was awaiting Sherry's arrival and to assess the severity of her symptoms.
It should be a big branch coming out here that's the left middle cerebral artery that supplies her ability to speak, her ability to move the right side of her body. And this is a blood clot that's lodged here and is blocking blood from that side of the brain that's causing her stroke-like symptoms.
After assessing Sherry and reviewing the findings, the decision was made to employ a procedure formerly known as a mechanical intra-arterial thrombectomy.
That's a way to physically remove the blood clot that's blocking blood to the brain and causing the stroke. And this has been a huge development over the past 2 years with the stent retrievers, in that this is a procedure that historically had taken about 2 hours to do, which is way too long for a stroke, for a patient having a stroke. Till now, the procedures are done typically in 20 to 30 minutes.
And the results were instantaneous. While still on the procedure table, Sherry's speech returned. And on hearing her voice once again make words, she recalls,
It felt good.
Once Sherry was out of the procedure, Mark recalls talking with her for the very first time.
One thing I remember saying is, I never thought I'd be so glad to hear you talk again, you know.
The key for success in recovery from stroke is time. Dr. Given and Mark Wanchik have this advice for you or your family members if they develop the symptoms of a stroke.
Strokes, unfortunately, don't hurt. They're not like heart attacks, so you don't have chest pain that makes you go to the ER. So often people make the mistake of, when they develop stroke-like symptoms, of saying, oh, I'm going to go lay down for a little while and see if this gets better. And that's the worst thing that they can do, because certainly the sooner they recognize that there's a stroke and the sooner they're receiving treatment, the better chance for a good outcome.
By recognizing these signs and these indicators, perhaps we can intervene if, in fact, some things that were unforeseen happen. If there was ever any doubt that miracles happen, she's right here.
In terms of stroke care, time is tissue. So if any of your family or you develop facial droop, difficulty with speech, weakness in the arm or leg, you need to get help right away, because these types of procedures are here, but they're very time sensitive. At Baptist Health Lexington, I'm Dr. Ryan Stanton for ABC 36 News.